Good afternoon, everyone. My name is Ami Acharya. Today, we are going to present on the issue of involuntary treatment order. I would like to start with what is involuntary treatment order. Involuntary treatment order is a legal provision by which physician may require a person with mental illness who meets certain criteria to follow a course of treatment in an institution. The Australian Mental Health Act 1986 sets criteria for the involuntary treatment of a person under the Act. The criteria under the Act are that the person appears to be mentally ill and the person's mental illness requires immediate treatment and that treatment can be obtained by person being subject to an involuntary treatment order. And because of the person's mental illness, involuntary treatment of a person is necessary for his or her health or safety, whether to prevent a deterioration in person's physical or mental condition or otherwise, or for protection of members of the public, and the person has refused or is unable to consent to the necessary treatment for the mental illness, and the person cannot receive adequate treatment for his or her mental health illness in a manner less restrictive of his or her freedom of decision or action. Involuntary treatment order is made by an authorized doctor. Review of the order is done by the Mental Health Review Board. A decision of Mental Health Review Board can be appealed in the court. In Victoria, it is the Victorian Civil and Administrative Tribunal. From 2010 to 2014, 6 appeals have been made to the Victorian Civil and Administrative Tribunal. 2 patients' involuntary treatment order were overruled and the Victorian Legal Aid explains that under involuntary treatment order, hospital or mental health clinic will give you treatment, you lose some of your rights and freedom, and you may have to stay in a hospital. You can be treated even if you do not agree. The question raised here is undergoing treatment against your will ethical? Hence, is involuntary treatment order ethical?
Good afternoon, ladies and gentlemen. My name is Pascal. This afternoon, I will be talking on autonomy with respect of involuntary treatment order in the management of a severely mentally ill patient. To set the pace for this discussion, I would like to define autonomy according to Musin as allowing a rational person to make his or her decision. On the other hand, according to Bocham and Chedres, if stated as a negative obligation, autonomous actions should not be subjected to any controlling constraints by others, irrespective of the consequences of such actions. In the autonomy-based argument, there are basically 2 positions, namely the deontological philosophy and the utilitarian philosophy. From the deontologist point of view, patient's autonomy is non-negotiable and should be respected in all circumstances. Conversely, the utilitarians believe that a severely mentally ill patient does not have the aptitude to receive, understand, or keep the relevant information about his or her clinical situations, with the possibility of making a choice among the possible options and the alternatives according to the personal beliefs. That is, severely mentally ill patients lack the capacity to make decisions with regards to treatment. Again, the utilitarians believe that involuntary treatment order is necessary to restore patients' autonomy, which has been lost to mental illness. And also, involuntary treatment order protects patients from self-harm and harm to others. However, The deontologists argued that the use of involuntary treatment order to prevent potential harm to others is an abuse of political power because the potential of social alarm is a post-crime which is in the jurisdiction of the court of law. Besides, studies have it that mentally ill patients are victims of abuse rather than offenders. Therefore, the hard paternalistic approach of the state to place the mentally ill persons on involuntary treatment order is injustice. In conclusion, the patient's autonomy is a key element to be considered in involuntary treatment order, but is not the only one or necessarily the most important. What matters is keeping an optimal balance between the clinician's beneficence and the patient's autonomy. Thank you.
Hello everyone, my name is Enwa. I will be presenting beneficence and involuntary treatment order. Looking at the involuntary treatment order from a beneficence principle point of view is interesting. Principle of beneficence is defined by Children's Bootcamp as a reference to moral obligations towards benefiting others. Beneficence is a fundamental part of the Hippocratic Oath. It is widely believed that the involuntary treatment order is a beneficent intervention that promotes good well-being and protects patients from harm. Even though it is done without satisfying the patient's autonomy, however, deontologists might disagree and see that autonomy should not be overridden under any circumstances. Most opinions about beneficence in involuntary treatment order are utilitarian. They do emphasize that the benefit outcome of involuntary treatment order. There's a wide misconception at times that the mentally ill will commit a crime. It is thus they need involuntary treatment order to protect society. However, many crimes are committed by those not suffering mental illness. So this argument cannot be used all the time to justify involuntary treatment order. Another argument is whether involuntary treatment order prevents suicide. This also has been widely and controversial, and some actually argued that coercion during involuntary treatment order could lead to suicide. And not all risk of self-harm is considered a risk of suicide. When applying involuntary treatment order under beneficence, there are a few conditions to consider. Firstly, there must be a major benefit to be promoted or a significant harm to be prevented. Coercion must be simultaneous to the positive expected result of the treatment. Also, the aim of the intervention must be either to cure or to improve the patient's condition. There must be no other alternative or method of intervention other than the involuntary treatment order. There should be a balance between loss of autonomy and the outcome of the treatment. Also, only the least necessary restrictions must be implemented, and the treatment must ensure compliance of the patient. These points do ensure that the focus of such an intervention is not to impose a paternalistic decision stripping the patient of autonomy, rather to benefit the patient in order to restore their autonomy. There's a major challenge initially in calculating the risk and benefits of involuntary treatment order. And so, risk versus benefit must be calculated carefully before placing a patient under involuntary treatment order. Also, there are issues that arise during ITO, such as increasing use of coercion when there is a lack of resources in the facilities.
Hello everyone, I'm Siddharth and I'm going to speak about non-maleficence and involuntary treatment order. Non-maleficence in simple terms means above all do no harm. In medical ethics, to cause harm is always wrong. It is also necessary not to contribute to harm. If a patient is suffering and you do nothing about it, you are contributing to the harm. In context of involuntary treatment order, in cases where ITO would be beneficial to the patient and if we withhold ITO, it is harm which we are doing to the patient and it is against the principle of non-maleficence. Also, there is evidence that delay of treatment of persons with severe mental illness may negatively affect recovery. Non-maleficence is an ethical principle and an obligative duty of a physician. There are situations which require an intervention, such as ITO, to avoid certain degree of danger or harm. No procedure in medicine is without any risk. We have to weigh the risk and benefits. Parens patriae is a doctrine that grants the inherent power to the state to act on behalf of those who are legally incapable to act on their own. The other side of the story is that what constitutes harm for all may not be harm for the patient. A patient may consider he or she is not harm to oneself or others and may refuse treatment. Also, treatment for a patient of mental illness, there may be the issue of social stigma attached to it in some societies. Places where mental illness is still a social stigma, other people obtaining knowledge of a person having a mental illness may do more harm to the patient than the illness itself, and it may aggravate the situation. Next is the issue of side effects of the medications. Some patients may be unhappy with the detrimental side effects. Weighing the risks and benefits of treatment should also account for side effects of the medications. Compulsory treatment means people who are living and surviving in the community, having committed no crime, under the ITO will be deprived of basic human rights and civic liberties. This is against non-maleficence.
In conclusion, each case of the involuntary treatment order should be individualized. A balance should be reached between the patient's autonomy and the physician's beneficence. We would like to thank you all for listening.